Hey guys, Dr. Sean here again. We're going to talk about pharmacology and nutrition and how they're different. They're not the same. And I got this idea a few weeks back because I was watching a television show with my son and I saw this commercial pop across there. They're talking about preventing a disease state with a drug. It can't. Just by its own definition, it can't. And so I thought, wow, that's where we're going now. We're going to try and prevent diseases by drugging you before you have it. And I thought, man, there's a place for medications, acute care, trauma, disease states. Those are fine, but not in prevention. So what is prevention? What are we looking at there? Prevention is avoiding something from ever happening. You prevent it from occurring. You don't throw a drug in there and dictate to the body and tell it, hey, you're going to do this until the problem actually does occur. It's a little weird, kind of backward thinking. So let's look at this a little bit. We've got pharmacology on one side, and we have nutrition on the other. Now, what are the inherent differences of the two? Pharmacology really treats diseases. Nutrition restores health. They're not the same thing. As we go through them then, we start looking and think, okay, pharmacology uses prescriptions or drugs to block or alter enzymes and block or alter receptor sites. Nutrition uses food. It's an important word here that sometimes gets misconstrued. And proper supplements to support organs and organ function. And then we get to the key one. Medications do not, and repeat, do not restore normal function. They don't restore normal. They can't. Nutrition, we don't use it to treat diseases. Nutrition restores normal. Medications and drugs treat disease. They're not the same thing. It's different. When you go looking at something, say you're diabetic, okay? Nutrition helps to support health by finding the cause. Why? What is the body not able to do? Medications go in there and say, look, oh my gosh, you're diabetic. We need that sugar to come down. We need it to come down now. Make it come down. Force it to. There's nothing wrong with that when you're in a disease state. But you cannot restore health by telling the body what to do. All you gotta do is look around. Let's pick any disease. We'll start with diabetes. How many diabetics you know that take insulin, that take metformin, glipizide, glyburide, any of the other million drugs that are out there for it, Actose, all these things? How many of them get rid of their diabetes? How many of them can say, oh my God, I'm no longer diabetic? 0. Atherosclerosis. How many of them no longer have heart problems? How many of their doc walks in there and says, you know what, Mrs. Smith, you've been on your calcium channel blocker. You don't have heart disease anymore. Or you've been on your blood thinner. It's all gone. Don't worry about it. None. Pick anything else. Alzheimer's? Stroke? They ever say, hey, you don't need an aspirin anymore. You don't need to take your drugs anymore. It's gone. It doesn't restore normal. It treats diseases. And it's okay for it to do that. But that's not what we do. We help people regain their lives by finding the cause. Why did you become diabetic? Why is your artery plaquing? Where is the inflammation going on inside you that's allowing this to happen? Can we put that fire out by supporting the body and giving it what it needs? If you do that, guys, you can perform miracles. A mentor of mine always said this, and this is how I end my radio show. Always said, if you don't expect a miracle, they tend not to happen. Expect them. Help people get their lives back. That's what we do. Dr. Sean.